who takes care of you in a medical emergency. Emergency physicians. These are the physicians that care for you anywhere at any time. Crisis is their specialty. They're experts in emergencies. When it really matters, you want the most qualified person in the room. The fact is, emergency physicians are one of the only ones who are trained in the other medical specialties: pediatrics, cardiology, trauma. This experience prepares each of them to meet the most unpredictable challenges in medicine. Emergency physicians make a pledge. It's their mission to provide life-saving medical care to anyone at any time. We're talking 24/7, 365. You don't need an appointment. They are a lifeline for everyone in the community, but especially those who have nowhere else to turn. The elderly, those without homes, those struggling with substance use disorder, or without insurance. No one gets turned away. Consider this. More than 1 in 3 of us visit the emergency department each year, and adults overwhelmingly trust emergency physicians in the event of a crisis. But polling shows many of us don't really know who is leading our care. In an ER, the emergency physician leads a care team of physician's assistants, emergency nurses, and other essential professionals. Each healthcare professional plays a critical role, but what actually sets an emergency physician apart? For starters, let's take a look at education and training. A physician is required to complete 11 or more years of formal education and is the only member of a care team that completes a medical residency. During this program, they treat actual patients, working hands-on with real people, not just simulated experiences. Residents train under the supervision of a physician to diagnose, manage, and treat any illness, any injury, any unexpected complication. Residents learn to look at a person as a whole, their community, their environment, all the social factors that impact a patient's physical and mental health. Before residents can practice medicine, they must pass a series of tests, earning a medical license with the option to become board certified, the gold standard in their specialty. Compared to others on their team, physicians also have the most hands-on training with real patients. Let's take a look at the numbers. A nurse practitioner is required to clock at least 500 clinical hours. For a physician, that requirement is at least 12,000 hours. That's like watching all 18 seasons of Grey's Anatomy over 32 times. So what difference does all that time make in the real world? Well, emergency physicians are there for us in the most frightening moments of our lives. They never assume something is minor. They have to consider the worst-case scenarios and work backwards. Say a patient comes in with a sore jaw. Emergency physicians know that this could be a symptom of something as mild as an infection or as severe as a heart attack. It takes thousands of hours and years of experience to be able to identify the subtle symptoms that could mean the difference between life and death. From simple to complex, they are prepared for anything. Many of us only think about emergency physicians working in hospitals, but in reality, we rely on them in all sorts of settings, on cruise ships or spaceships, from the State House to the White House, in rural areas where equipment and resources are limited, at the scene of car crashes and plane crashes, and on the battlefield, during public health crises, natural disasters, and terrorist attacks. It's the emergency physicians who show up and serve. Every day, these people step into unpredictable life or death situations. It's their quick thinking and smart decisions that save millions of lives each year. It takes dedication, years of training, and a passion to serve, to provide care in a time of chaos.